Facility benefits versus home care benefits. We see this a lot. So in many cases, it is very specific. The policyholder elected with the carrier the options and the benefits of the policy. So we do see long-term care insurance policies that allow assisted living, skilled nursing, memory care, and also a home care benefit. Now, in some cases, it's a one-to-one. So a long-term care facility, like a skilled nursing, it may pay $150 a day, and the home care benefit is $150 a day. Sometimes we see an 80% benefit for home care as opposed to 100% of the benefit in a facility, in a regulated level of care, like assisted living, memory care, skilled nursing, those levels of care. So simple math, if your benefit was $100 a day and it pays 80% in the home, and maybe $80 a day toward care for a caregiver, as long as you get through the elimination period, as long as you show 2 or more activities of daily living, or whatever your policy states. And in the home, it may be $80, where in the facility, assisted living, skilled nursing, or memory care, it may be $100 a day. So we've seen it 70%, 75%, 80%. We've also seen 100%. So it's a one-to-one where they're the same. But knowing and understanding the benefits of your policy is very important. And I would always encourage an elder law attorney, a financial planner, a power of attorney over your medical and your financial, always being in the loop, if that's family or a close friend, and understanding your long-term care insurance policy. So the facility and the home care benefit, we also receive questions. What about the elimination period? How do I get through that and then, receive the benefits of the policy? Well, it's very policy specific. So we have seen people receive care and caregiver services in their home. They have the home care benefit, and maybe they have, 100 days of caregiver services, but they know long-term they want to live in an assisted living setting. And so they may get care in the home, and it may have been a 90-day elimination period. And so what they were able to do is receive the care services in their home. Maybe that was at a lesser rate than what they would have been paying for living in that assisted living. And then once they move in the assisted living and the policy starts reimbursing the policy holder, at that point, maybe they choose to move in. Again, that's very policy specific, but if there's a home care benefit and there's a facility benefit, we often see them counting those days toward services. A follow-up question to that is, we do have people ask, does a hospital stay, do home health days, do home health visits, does a rehab stay, does caregivers in the home, and then assisted living, do all of those things count toward your elimination period? The short answer is, it depends on your policy. I did see one just this week that counted 30 days in the hospital. The person ended up staying 46 days in a rehab setting, and they had a 90-day elimination period. So they were really excited, where they really only have to pay out of pocket for 14 days because they have a caregiver benefit. And then they'll be at their 90 days, and they'll be reimbursed from that 91st day on. So they have validated that with their policy. They have communicated with the long-term care insurance carrier, and so everybody's on the same page, and so that family is very excited to be able to utilize these services. As a side note, what was amazing is this client sold long-term care insurance, and so he was very familiar. He's still very sharp cognitively, but has some physical demands. And he knew all of the ins and the outs of his policy. So as frustrated as he was to be in the hospital, as frustrated as he was to be in rehab, he knew every one of those days counted toward his elimination period. And he knew once he was discharging, he was going to have care in the home. And so they were counting the days, and then they really have communicated. They've got it in writing, and everybody's on the same page. One thing I've been impressed with that gentleman, his wife is very familiar. They've got a folder set